Well, joining me in the studio to discuss that a little further is the social commentator Dorcas Gwata. Thanks very much indeed for coming in. So, take away the hoe and give them the scythe. I mean, you know, what difference is that going to make? Because I suppose it's a symbolism, isn't it? I mean, a bit like the sort of the bit, the harness and the whip in Animal Farm. This kind of symbolizes the work that women do, but they use other tools, don't they? I mean, what you really should be focusing on is empowering women.
Charles, I was really pleased that this topic came out, and I was rather surprised that I would be surprised if it got any momentum because al-Bashir overtook the whole summit. It became about him, a man who really hasn't made any much contribution to women empowerment. But this is a great initiative. It's much more complicated than that. We've put together some really important issues about how women need to have their own banks, they need to be empowered, girls back in education, land, all the critical issues that we identify. But for African women in particular, it's going to be much more complex than that because culture plays a really, really important part of our lifestyle. This is who we are, and this is what we are. And breaking through that is very difficult. Secondly, we don't have a critical mass movement in Africa that simply empowers women. And that is a voice from the citizen on the ground. The West does this really, really well. If they want to mobilize and change things, they do that really, really well. If they put agendas on, on the street, people mobilize that. So this looks great on paper. It is run by our African Union. Can they mobilize it? Can they deliver on it? We'll be sitting here 20 years later saying, what did they do about it?
The key to that is access to land, isn't it?
It is.
It's about redistribution, giving people access to land. And as you correctly identify, there are cultural issues to do with that. Because in many, societies, women can't actually inherit or own land.
They can't, but just because culture is a challenge, it doesn't make it impossible. There are some countries in Africa that have got the balance quite well. They're not without their own challenges. Botswana's got that quite well. Rwanda's got that quite well. I think ultimately, really, it is there needs to be a lot more representation of women in many different institutions. Ellen Johnson Sirleaf is the only female African leader in Africa at the moment. That speaks volumes. So we need a lot more representation where it matters so that we can mobilize this. But we also need commitment because governments simply saying we have a strategy, gathering dust in a cupboard, isn't going to move things.
Actually, this young woman who came in here and talked to us, Yasmin Bello-Osagie, had a very good point. She said that there seems to be a lot of focus at the top. I mean, you'd find women ministers, a woman president, and then at the bottom, everybody's talking about helping the woman with the hoe. But what about the middle-level people who are actually going to create wealth and move the country forward, the continent forward?
And I think until we get those structures well in place, then we aren't going to see any movement. They are thinking and innovative. How are they going to feed their children? They've got ways of structuring their own lifestyles so that somehow, some way, the family is fed. That, to me, is enterprise in itself. What we know, though, is that they work much harder than your average woman around the world. They carry a heavier burden in terms of family responsibilities, wider family responsibility, education, health. So we know that's true. So this is a great initiative, if it mobilizes, to lift up that burden so that your everyday African woman isn't treading 10 miles down the road, bending her back on a hoe.
So essentially, if you want the continent to prosper, you have got to empower women.
You've got to commit to it, deliver on it, and foster and see it through so that it is sustainable. It is possible. Other countries are doing. India is not in a terribly, different situation. To the context is very, very, very similar to many African countries. Those are the kind of contexts we need to be looking at. They've managed to lift up many of their people out of poverty. How are they doing that?
But are you at all encouraged by what you're seeing, by the fact that the AU has made this the theme for their summit? And hopefully things will move from there.
I was wow, Charles. How, this is amazing that this institution is coming up with this. I had a half wow because they have a rather reputation of talking and not delivering. So there needs to be pressure on this institution to deliver. But it was a great moment for us to be sitting here today talking about empowering women.
And of course, Michelle Obama, who's one of the campaigners for girls' education, has talked volubly about that. Why is that still such an issue with African countries?
Do you know, I think it's a global issue. Girls everywhere, women everywhere, wherever they are, even on a board level, are still facing some structures. You will hear women in Silicon Valley saying they face some structures. So there are global issues which are going to be relevant to us. I think in Africa, for us, far too many women are carrying the heavier burden. And we're not, those who are coming up in the middle class aren't necessarily women. Some of those are men.
Dorcas Gwata, for the moment, thank you very much indeed. Plenty more still ahead here in Africa Wrap tonight. The Tanzania Link is a mental health partnership between the Central and Northwest London Health Trust and Mirembe Hospital and School of Nursing, which is Tanzania's national psychiatric hospital. Tanzania is a low-income country with a critical shortage of mental health professionals and only 17 psychiatrists to serve its population of 44 million people. Furthermore, mental health is neglected in Tanzania because of stigma and competing health demands. Well, this is a subject that is close to the heart of our guest tonight, social commentator Dorcas Gwata, who has loads of experience in mental health issues. Thank you very much indeed for staying with us. On the face of it, it sounds like, you know, a great partnership, altruistic on the part of the English National Health Service. They use their superior expertise and resources to help the poor people in Tanzania. But it's actually a richer partnership than that, with benefits for both sides, isn't it?
It truly is, Charles. And the funding for this program comes from the International Development DFID, which funds international development in the UK, and that's ring-fenced through that. So the money isn't essentially diverted from the NHS, but there are huge benefits for both sides. A healthier Tanzania is a wealthier Tanzania, and a healthy population in any sense is kind of benefits. What the Tanzanians are benefiting here is from evidence-based practice that we benefit from here. So we're able to share those tools. Remember, the UK has a very diverse population, so these transcultural skills that we learn here and that we have here, we're able to share through. The learning here is very joint. This is not a patriotic link in which the British take skills into Tanzania and we teach them what to do. Quite not. It's actually the other way around. We learn from each other. They give to us as much as we give to them. But ultimately, it's about patient development, patient care.
So what sort of challenges do mental health workers in Tanzania face? Because, I mean, you know, you think of mental health as kind of Cinderella type of service here in the UK, and most people would, you know, think it's no different in countries like Tanzania.
The main issue is staff shortages, and those are right across Africa. So the number of nurses that you might have here on a ward, which sounds alarming when we go talk about it here and the government talks about it, is way, way less. Their opportunities to develop themselves and actually progress with themselves are very, very limited. The institutions themselves are actually, most of them, built by the British when they left. So they are as they stand. So in some ways, many of them haven't been developed. So there are many sort of opportunities for development which we have here, which they don't have. Equally, though, they are in a very good position to be, because they have poor resources, they can be very innovative and creative. So when we go there, we're able to see just how creative they are.
So what have you seen there? Because, I mean, the sense that you get is that the healthcare systems in a lot of those countries are extremely weak. I mean, what are they doing to protect people who are vulnerable as a result of their mental health problems?
That's a really huge challenge. So what normally happens here is that people travel miles with their relatives to bring them to this institution. Often they're very, very unwell, and often they leave them there for a very long time. So the structures that we have here to safeguard vulnerable people are very, very poor. So often patients are actually safer in a hospital sometimes than they are in a community. But this is also about government commitment to health, and health is a wider issue. So in Africa, our spending on health tends to be much, much lower, and those funds, when they're available, easily get diverted to many other areas. But the most warming experiences I've seen in Africa is when people make use of simple tools. They'll break a song and use a drum and sing their, and that's absolutely therapeutic, and those little moments are as important to the human spirit here as they are in Tanzania.
Now, this scheme, the Tanzania Link, as we mentioned earlier, was funded in part by the Department of International Development, and of course the DFID as it's called here, comes in for quite a lot of criticism in the UK about how it uses money.
This is in Britain's interest. A much stable and healthy Africa means that people are not migrating as much as they can. We look at the wider issues that we always discuss here in Africa Wrap, Charles, where people are moving and migrating. Once you stabilize institutions and countries, you reduce risk of all these issues erupting. So it is in British interest. We learn a lot from Africa. And
yeah,
we bring a lot.
Just remind me before we end this discussion, Dorcas, about what the UK is getting out of this. I mean, it's pretty obvious what the Tanzanians are getting, but what is the UK getting out of it? What would benefit the health service in this country?
So your average clinician, doctor and nurse who went out to help out in the Ebola crisis, who came back here to the UK, is a better practitioner than they were before they went to the
wider experience, of
Absolutely. Those experiences outside the normal context in which you're applying will make you a better practitioner. And most of the most experienced clinicians I work with here in the NHS have had global exposure, and that's important.
Dorcas Gwata, thank you very much indeed.